Silence is an important aspect of counseling. For the counselor, it can feel awkward and even intimidating when there is a moment of silence during the counseling session. The counselor may feel a need to fill the silence and may immediately start talking. In fact, silences in counseling can be good if used appropriately. When the counselor is silent for a couple of moments in the session, this silence can encourage the patient to continue talking. If you use silence as an encourager, your nonverbal behavior should reflect this, for example, by nodding and maintaining eye contact. Silence can also be a useful tool when the counselor has said something that she really wants the patient to think about. For example, if the counselor makes an important insight or shares a piece of important information, it can be useful to allow the patient time to think about and process what has just been said. A third example of the appropriateness of silence is when a patient cries. This is often the type of situation where a counselor feels pressure to immediately do something to make the patient feel better. However, it's a normal response for people to cry when they're upset about something. It's okay to allow the patient a few moments to connect with the feeling and allow them to feel sad before you intervene. The following demonstration will show you one way in which you can use silence in session.
Sissy, so you tend to forget to take your medication in the evenings. Why do you think this is?
In the evenings, there are a lot of people around the house. There's nowhere for me to take my medication in private.
It sounds like you don't want people to see you taking your medication. I wonder if we can talk about this a little bit?
I'm scared of what people will think. I'm scared of what people will say or how they will treat me if they know that I'm HIV positive. I'm worried that my husband will leave me and my children.
So it sounds like your fear of your husband finding out your status is preventing you from taking your medication at the right times. Sissy, what is going through your mind right now?
I'm thinking about what you said. I think you are right. I'm so afraid of my husband finding out that it stops me from taking my medication in evenings when there are people around.
Did you notice the long pause? What do you think the patient was feeling? What do you think the counselor was feeling? Where does the discomfort come from? It comes from the assumption that in a social situation, silences are usually awkward. In the counseling context, however, it allows patients the opportunity to process, to think, to reflect, to feel, all of which can be psychologically beneficial.